Good afternoon and welcome to our final and last COVID-19 EOC update that we have been bringing to you for every Monday / every other Monday for the past 15 months. I am joined today with the Public Health Director at the Franklin County Health Department, Judy Mattingly, Mayor Lane Wilkerson, Judge Houston Wells, and the emergency management, Mr. Tommy Russell. Thank you guys for joining us. I know it's been a long 15 months or so that we've been doing this, and it's just so grateful that we're finally at this point where we can talk about positive news on this event and get some updates and some positive words. So I will start with the judge. Judge, do you have anything you'd like to share with the community as things are reopening and getting back to that new normal that we hear a lot about?
Yes, Brittany, thank you. And thank you, Judy, and to all your staff at the Franklin County Health Department. You've been amazing. You've been wonderful. And you've just done a fantastic job. We've gotten through this ugly part of our history and maybe one of the ugliest parts of our history. And it was because of you all, because of your efforts to make our community safe, that our community has turned out well, as far as you can say it, or as least as you can say it. So I can't say that there are people that have died, and so we have to look at that as a major concern. But I want to say thanks to all the citizens of Franklin County. You have been awesome, and we've gone through really tough times, and we've made it through it. There's light. Over a year ago, we were talking about hopefully there would be light at the end of the tunnel when summertime came, and it's here, and we are seeing light and hope. And I do want to say that it's still out there. The COVID disease is still out there, virus, and we have to be careful. But we can get vaccinated. We can still do lots of things. The governor's opened up. And I think we also need to say thank you to the governor. The governor has done a fantastic job of keeping us informed, of keeping us safe. And so to the governor and all of the staff, we appreciate what they've done as well. So with that being said, we've opened up. Our parks are opened up. County government is opened up. Our businesses are opening up. And so God bless everybody. Thank you so much for all of your efforts and hard work in trying to keep us safe. So with that, I'll pass it on to the mayor.
Thank you, Judge, and I'll say the same. Thank you to Brittany and Judy and Debbie and the rest of the Franklin County Health Department. As you said, Brittany, you all have been doing this for 15 months, and I've only been doing this since January, and I realized the commitment you have to do this week in and week out, and just follow. This has consumed this has consumed the health department for the past 15 months, and so I do commend you all for what you all have done. As you know, Franklin County is ranked either first or second in the state in terms of vaccination rates, and that's hugely important, not only for our residents and the safety of our residents, but one of the things I've talked about is we need to come out of COVID-19 stronger than we were coming in. And the one way we're going to do that's the sooner we get everyone vaccinated or the most people vaccinated, the better. And we're going to be well positioned. From an economic standpoint, tourism, people are going to look at that. And in those counties that aren't doing as well as we are, people may think twice of visiting. So thank you all for that and keeping everyone safe. And of course, thanks to the governor and his leadership and looking out for Franklin County. And I know he thinks highly of the Franklin County Health Department. As for the city, we're opening up as well. We're going to have our first in-person meeting tonight, our city commission meeting tonight. So we're all adjusting to the new normal here. But thank you all, and to our citizens, keep it up. This is not over. There are variants out there. People can still get sick. I want to point out that almost all of our residents over 65 have been vaccinated. I think it's somewhere like 99%. So that's a big deal. And so thank you to our citizens for taking this seriously.
Absolutely. I think the mayor and the judge both said that very nice, and that's exactly what we feel at the health department. Is we are so proud of our community and how they have stepped up to be on that leaderboard, of vaccinated residents. And, I know when Judy talks here in a minute about our case count, 4,000 is a lot of individuals that have, tested positive. However, it could have been a lot worse. And we are so thankful for everyone who is, ridden this ride with us for the past 15 months and able to, keep this at a small number and get those vaccination rates up. That's definitely what we want to see as a public health agency is that, and that's exactly what we're seeing. So we are forever grateful to our community partners and to the community as well. Along those lines, Judy, do you want to jump in and give an update on where we are with vaccinations and clinics, and then where we are with those COVID cases? If we're seeing an increase, a decrease, or what are we seeing?
Oh, certainly. I'll go ahead and start with those case numbers. I know a lot of people are still following along on the state, website, COVID-19 website. So you will see there that our incidence rate is at 9.8. And so that still has us in the yellow right now for community spread, but we all still need to be careful because that rate of 10 will push us back into the orange. And that just means a more accelerated spread. So our total case numbers are 4,081 with 35 active cases. And the reason that incidence rate is a little bit higher right now is we did have a very big case number day last Monday. And so our belief is that was still due to all the gatherings, due to the graduation parties and the Memorial Day parties, that we were, seeing those cases start to turn positive. But it is only the 35 active right now, all doing well, thank goodness. And we have had those 61 deaths that, of course, have been reported in the media that make this so tragic that we've been dealing with this so well, or for so long now. But on the flip side of that, the good side is like the mayor and the judge were saying, we are number 2 still in the state for vaccination rates. We're only that 1% behind Woodford County. So I know we can still pull ahead of them. And we'll talk about some opportunities to do that in just a moment. You're exactly correct. Over 65, it is greater than 100% of our residents over 65 years of age have been vaccinated. Over 18 years of age, that does deserve a round of applause. Over 18 years of age, we are at 75%, and our total vaccinated population is 62%. And at the health department, we have given 12,425 of those doses. And of course, thank you so much to our statewide partners, our pharmacies, our little clinics, everyone else that's jumped in to give those shots as well. And to our county and our city and emergency management, anyone who's come to get a shot has seen all of them there too. It takes a village, to get an entire village vaccinated.
It
Certainly does. And while we're talking about vaccine dates, I don't have a lot of dates to throw out at you right now today, but I am going to give you opportunities moving forward to get your vaccine at any time if you are one of those that have been concerned and have been waiting. So today we were out at Fit for Life Gym, and we'll be leaving there at 1:30 today. We were giving vaccines. The next opportunity for Johnson & Johnson 1-dose vaccines will be this week also, this Thursday, June 17th. From 11 a.m. until 1 p.m. And this is partnering with Access Soup Kitchen and Men's Shelter, and will actually be right across the street from the Soup Kitchen and the city parking lot there. Again, thanks to our city and county partners. And stay tuned to our Facebook page and fchd.org, our website page. We are working on an opportunity to provide incentives at that vaccine event this Thursday. So stay tuned. We're waiting for that grant confirmation to come through. And then moving forward after those dates, we do have one other big date already scheduled, and that'll be at the Franklin County Fair. We'll be out there on July 20th and July 22nd from 5 to 7 p.m., both of those nights, giving vaccines. Stay tuned. We hope to have both Johnson & Johnson and potentially Pfizer there also for the 12 to 15-year-old or 12 and up age group. And we might even have some testing opportunities there at the fair, COVID-19 testing in case you are feeling sick or haven't been vaccinated. And always visit our Facebook page or website, Facebook and website, fchd.org for more testing opportunities. If you might have some of those symptoms or have been in contact with someone that's positive and are concerned. We have lots of openings this week, both tomorrow, the 15th, and June 17th, this Thursday, to come into our clinic. You just register for those appointments at fchd.org. So I think that about covers our vaccine dates, except for just calling our clinic at 564-7647. And what we are doing is we are alternating COVID vaccines. We're doing it every Friday. So this Friday, you can call and make appointments if you want Moderna in particular. And then next Friday, we'll offer Pfizer, and we'll keep alternating that. So if you just call our clinic at 564-7647, let them know which vaccine you want, and they will give you the date for that. And of course, we're trying to accommodate whatever request you'd like, whether it's Moderna, Pfizer, or Johnson & Johnson at this point. So I think that's all of our updates on our case numbers and our vaccine rates and numbers and opportunities. The only other thing, Brittany, that I have to point out is I hope that everyone is well aware of the new executive order that was signed, and thank you to our governor for that and all of the leadership throughout this process, where all of our businesses are back at 100% capacity, and the masking requirement has been rescinded or lifted, except in a few exceptions there. So the exceptions where we still need to wear our masks are public transportation, whether that is inside of or outside of the United States, our healthcare settings where we might have, particularly vulnerable individuals to COVID-19 and still need to protect them. And right along with that is our long-term care centers. We all still remember that as our age increases, our risk of severity of this virus increases. And then masking is still recommended at correctional facilities, homeless shelters, for anyone with a compromised immune system. It's still recommended that they take that extra precaution. And then, of course, anyone with COVID-19 or that has tested positive, for COVID-19, they should still wear their mask. And other than that, we can all still practice good hand hygiene, covering our coughs, staying home when we're sick. We learned this year more than any other that will prevent not just COVID, but things like the flu and common cold viruses. And so I don't think that any of us will forget any of those lessons anytime soon, I hope. And I'm sorry for being long-winded there, but I think that is everything, other than, again, those immense thanks to everyone, all of our community partners or community members. I do feel like Da Vinci's Pizza might deserve a special thank you for those incentives they offered not long ago.
Good deal.
Thanks, Judy. Those are great reminders. Just in general, those public health measures, preventative health measures that we would love for people to take on and continue on with those. Washing your hands and covering your cough and disinfecting those common areas. All those lessons that we have learned over the past 15 months, continuing on with that. I know me personally, I've enjoyed not being sick for the past 15 months or so, with all the increased hand washing and people staying home in the masks and things. And so I think those are great reminders. And also, if you need any more information about that executive order, we'll be sure to get a little infograph on that executive order, which is 2021-386. But we'll be sure to get that executive order up on our Facebook page with a little infographic about where still to wear a mask when those special populations, and what does it mean for us in Franklin County. Tommy, do you have anything you'd like to add? Anything that's going on this summer, or now that we're back to 100%, what does that look like from the emergency management standpoint and all the events we have planned that folks are very eager to get to, I'm sure?
Oh, I'm sure. Judy, I have one question for, as far as testing goes, can people contact the clinic for you all to get a test done?
And they certainly can. And if they do have internet access for testing, we still have the online scheduling availability at fchd.org.
Because I feel like with some of the restrictions eased now, that we could encounter some hot spots, just like you were mentioning from the Memorial Day weekend. So, it seems like a long time ago in January or February, one of those months, that the previous mayor and my staff had a conversation about what was going on over in China and how long we had before it got here, and then, where ground zero was. And I think we started at the end of February, the 1st of March, and then that first case hit like 10 days later, and I was thinking we would have 2 months or 3 months before we would ever encounter that. So it has been an extremely busy period for all of us, with numerous conversations. And Miss Judy, I appreciate you putting up with us as I do the judge and this mayor, because we have a lot of conversations about a lot of things. So I think the biggest thing for me now is for people that are sick, if they would just stay at home, and if it persists, then go get tested. But I think right now, the biggest thing for us to do to try to finish this off is if that you are sick, to stay isolated, stay at the house, and again, if it persists, to go get a test and see exactly what it is, and I think that will push us past the finish line. That's all I have, Miss Brittany, and thank you all for all your help and support for EM.
Thank you, Tommy. Oh, the judge has one more thing to add.
I just want to say this, and you can add to it however you want, Judy, but as we all know, there are uncertainties about the future of the vaccine and what will happen, whether it needs to be a booster or not. And if so, we'll come back. We'll be right there to advise the community and help the community through that process. And you'll know immediately when and how to proceed with that, if that does come about, right, Judy?
You are exactly correct. And that is a good reminder. We get that question a lot. Is a booster going to be required? So of course, the CDC and the FDA have ongoing studies about that. And if that order is put out that we need a booster dose a year after our last dose or something, we will come back together with you all. We will advertise. We will get the word out there. And we could even at this point send anyone that's gotten a shot with us know that you get automated texts and emails and voicemails reminding you. So at this point, you're already in our scheduling system. And if you should get a booster dose come due, we will let you know.
That's great. And Brittany, as we close, when everybody has said something, I would like for all of us to give a round of applause. Let's end by giving a round of applause to our community, because what a fantastic job. We're so proud of our community. What a great job they've done. So whenever you're ready, Brittany, let's end. Abby will end us with a round of applause to our community.
I love that idea, Judge. Anyone else have anything to add as we officially sign off for our last weekly update on COVID-19? As we've mentioned, this is not going to be the last that you hear about COVID-19 from us. However, on a weekly basis and with these 1 p.m. updates, this is us signing off from providing these. So everyone good?
Well said, Brittany.
All right.
Thanks, everybody, and thanks, community. Awesome. Way to go, Franklin County.